Hi, good morning, everybody. It's great to see so many people joining us for this webinar today. My name is Joy Duxbury and I'm Chair and Trustee of the Restraint Reduction Network. And today we're going to be talking about the Restraint Reduction Network training standards and really going through information about them and to answer any questions that you might have in order to make sure that you're ready for them, basically. We have quite an esteemed panel for you today, not least of which we'll be starting with Adji Lewis. Adji isn't joining us, but we have a video clip from Adji just talking through the importance of these standards and why we need to really engage with them going forward. Adji, as many of you will know, I suspect, some of you may not, is the mother of Shani Lewis, who died whilst being restrained several years ago now, and has been lobbying for change subsequently as a result ever since. We'll then move on to Chris Stirling, that I know all of you, I suspect, will know, who'll give us an overview of the standards. Guy Cross from the Care Quality Commission, who will just give us the CQC's perspective on the standards very briefly. Marie Lovell from Skills for Care, that will give us very important social care perspective, because obviously it isn't just all about the health setting. And then we'll move on to some discussions from the panel. Just a few things to say before we do start and listen to the lovely Adji is to a few housekeeping matters. There is a chat function, and there's also a question and answer function on this call. So please do feel free to chat away, but if you have got specific questions for the panel, can you please click on the Q&A button on the bottom right hand corner of your screen? That will just help us streamline the process in terms of being able to answer questions. That would be most helpful. We are recording this this webinar just for people's information, and we will be sending out the presentation to people who are registered on this webinar. So fear not, you don't have to sit scribbling away as you're listening or engaging with the conversation. So I think other than that, we'll make a start, folks. The webinar is due to run for 45 minutes, so we should be finishing around about 11:45, if that's important to folk to know. And we'll move on and we'll hear what Adji has to say.
Professor Bob Peckett, this who was a coroner's witness, said, you know, the clinical evidence suggests to me that Mr. Lewis was terrified, that he was paranoid and scared rigid of the thought of restraint as he thought of it in a straitjacket. But by extension, I think being locked into a seclusion room or being restrained in a similar way would have been exactly the same effect. And I think that his terror must have greatly added to his psychological disturbance, that his heart rate increased, his muscles contracted, and the effects of his body chemistry changed. So Shani was restrained over a period, 2 restraints over a period of about 45 minutes. And the police did it in 2 sets. So they had some police officers restraining first, and then they, in the inquest, they said, oh, we were so hot, we had to ask for water. Oh, we had to take our jackets off. And even the coroner said, didn't you think about the person you were restraining? That they might be hot and need water and need, you know, obviously not. All sense had gone, you know, had flown out of, you know, as out of the window. They were not capable of thinking that. So 2 sets of restraint. And when Shani went limp, his body went limp, they thought he was faking it. He was pretending. So they left him on the floor of the seclusion room, locked the door. Well, actually, the door slammed, locked. They had to look for the key, realized he wasn't moving, found the key, went in there and administered CPR. And they're very good at that. They resuscitate you or you think they've resuscitated your loved one, and then they take them to the hospital where they pronounce them dead. Now, we found out at the inquest that if they had performed CPR when Cheney went limp, instead of ignoring the fact and thinking that he had faked it, pretended, that his life might have been saved. The Lewis family were very honoured to be asked to write the foreword for the Restraint Reduction Network handbook, and we did it, and it's quite a read. I think if you haven't read it, you should read it. It's quite traumatic. We as a family feel that it's really important that restraint is either eliminated or minimized. I can't think of any family that would want to go through what we went through. And I can't think of anybody who administers restraint would want to feel how it must feel if you restrain somebody and they die. I just don't think you get up in the morning and say, oh, you know, that's my aim. No, you don't. But because there's such a thin line between life and death, it just takes a second for that to happen, to restrain inappropriately or unnecessarily for too long a period, and a person dies. It's something that I don't think anybody wants on their conscience. I feel that really there are ways of de-escalating situations, and I know there are other ways of achieving the same result. It's just how, it's just thinking out of the box. It's just stepping back and thinking, oh, wow, we heard about Cheney Lewis and how he was restrained and how he died. Look, there must be another way. And there are other ways. I just feel that human rights issues are sort of impinged. You know, people are restrained, especially during this COVID period. They've been restrained. We're hearing more stories of people being restrained, excessive restraint on mental health patients, on autistic patients, on dementia patients. I just know that it's people's first thing that they think about. You know, especially maybe if they want to administer drugs, you know, I know that's what they will think about. Oh, you know, we'll restrain, but it's dicey. It's dicey. And I really wouldn't like anybody to feel what we feel. And they've had to put, you know, had to overcome, you know, our feelings of horror and sadness. And yeah, I really would urge people not to restrain if at all possible.
Okay, folks, that's a pretty powerful message for sure. I think the sad fact of the matter is as well that that's not an isolated incident. We know there have been many deaths related to restraint internationally over the years, and no doubt, sadly, there will be more to come in the future. I think what Angie is saying, that there are alternatives, there are other ways, is testament to the training standards, which aren't ready to just try and make people stop restraints, but are there to try and encourage people to take a very much an organisational, preventative, human rights focused approach to minimising the use of restrictive practices more generally. There's so much that can be done out there, and there's so much evidence now coming through that these things do work and that they do minimise the trauma of individuals involved. So do urge you to embrace the standards, folks. And on that note, Chris is going to talk you through the standards briefly. Thank you.
Thanks, Joy. And just really to add to what Joy's just said about Agie's video, and knowing Agie for quite a long time, and each time I hear her sharer experience, it doesn't lose its power. And it just reminds me, a personal reflection of when I came into my profession, no training existed and it was chaotic. And I suppose what happened over the years is, as training developed, there was a very big focus on staff safety and physical restraint. And I think what AGI conveys really powerfully is we've moved to somewhere different now, where we want to see either restraint eliminated where possible, but if it does happen, that it's an exception event. It's no, I think we'd been through a period where almost it normalized, and that kind of brings me to the standards really. I think what the RRN standards are attempting to do, and it'll probably, you know, improve over time, is to kind of get that balance right. So to improve governance, and as Joy said, to kind of move organizations away from this reliance on restrictive interventions. So it's all about everyone's safety. It's a human rights perspective. And we want to prevent scandals and abuse, and we want to minimize harm to everybody involved. The standards themselves also kind of address another factor, is again, the perspective that it's all about training, and we know that it's more than training. We know that abuse occurs within an environment that's corrupted, and as Aji quite rightly says, it's not that staff wake up one day and decide to do the wrong thing. Sometimes there's a corruption within their working environment that over time develops. So hopefully, you know, the standards start to point to training as one aspect, but there's lots of other aspects that need to be addressed. For those of you who don't know, the RRN is a charitable organisation. So although CPI set up the RRN, it's now independent charitable status, accredited by UCAS to the ISO standards, and more recently has been strengthened with support through legislation and statutory guidance. And I guess another important point, which Guy will talk about, is the role of commissioning and regulation, because perhaps that's what was missing with the previous scheme, which was voluntary. That there's a much stronger tie-in. The standards themselves are really about making this strong connection. So it's not just about the training provider. It's not just about those trainers who are certified or authorized to teach the training. It's really about all the three parts: what's taught, who it's taught by, and who the provider is. And under the scheme, that's referred to as certificated training service. And I guess one of the points for many providers who currently use a training provider is often they'll go down the model of train the trainer. So where the restraint standards under the Restraint Reduction Network are much stronger now, is it places greater emphasis on the service provider to also demonstrate how well they meet the standards. So it's a much stronger focus, and hopefully we'll achieve those ambitions of either eliminating or certainly help to ensure organizations minimize restrictive practices of all types. Restraint related deaths typically impact on physical restraint, but they're all manner of restrictions. The other thing that's really important to know is all the buy-in from all the different agencies, professional bodies, all campaigning for the same thing. And I guess that's probably true of everybody who's on this webinar. Everybody probably shares the same passion and belief to do the right thing. So it's good to know that there's this broad consensus that the RRN standards are a really positive move in the right direction for professionals and the various people they support. In terms of the certification scheme that's managed by the RRN in conjunction with Bild ACT, and then specifically we've got the training standards, which training providers need to meet as a benchmark for evidence. And there are 4 areas of the standards, and they apply across all sectors. So whether you're working with children, whether that's in a school environment or a looked after environment, in social care, or in healthcare, these standards are really, really important for all those services. And the way the standards have been designed is to address the wider issue of restrictive practices. So these four elements that I'm just briefly going to talk to. The first part is pre-training delivery, and that's the standards that relate to ensuring the right training is delivered to the right people and the content of that training is appropriate. So factors such as training needs analysis, formal written proposals, agreement on whether physical or restrictive aspects of that program are relevant to that staff group and the population they work with. So it puts greater emphasis on making sure we tailor the program to the right audience. The second section specifically then goes into the curriculum content itself, making sure it fulfills all the legal and professional issues. There are stipulations on preventative content as well as reactive physical content, which to some extent already existed with the previous bill scheme, but these standards are much stronger and much more explicit about the things the curriculum should cover. The third area of the standards relates to post-training delivery. Again, it's, covers everything from competency assessment and record keeping and documentation of the training that's been delivered, but also making sure there's some quality monitoring about delivery, about the competence and performance of instructors who are certified to deliver a particular training package, and also to make sure not only that instructors maintain their competence, but also how instructors are working with staff teams who do the training to maintain their abilities to be safe and to ensure that through the workplace transfer, staff are implementing the training effectively and helping their organization to eliminate or minimize restricted practices. The final area of the training standards, again, is looking at the wider quality assurance mechanisms. Again, because it's all through UCAS and the ISO standards, there's a much stronger quality assurance process throughout the whole aspect of training curriculum and training delivery. So I'm not going to go into any more detail because obviously you can download the standards and look at that. In terms of how these implemented then, the scheme talks about two particular delivery processes. There's the certified training provider, the organization. So for example, I work for CPI. We're a certified training provider. So that means we've been able to demonstrate we meet all the standards across those four areas. We've been subject to that independent evaluation of all our training, and we can demonstrate how we as a training provider, if we come into your service and train your staff, can deliver RRN certified training. But we know, like many other training providers, that's part of the way we deliver training. But for many organizations, it's much more effective and efficient and has greater impact if we can train instructors within their organizations. So under the scheme, that's called an affiliated service provider. So the plan was always to set in place a timeline to be able to allow training providers and the customers and the organizations they work with to meet the standards. So first published in April 2019, then a process of certifying existing training providers commenced, and then we hit the COVID pandemic, so that kind of put the brakes on things, but we're still on track for an April this year launch. So there is the expectation now that whether an organization such as CPI come in and train your staff, or whether you're working with an organization and you've got your own instructors, that you can demonstrate as a service that you're also meeting these standards. So the target of that is April 2021. And that probably brings me nicely to the end of this section and to Guy, who's going to give a CQC perspective. So over to you, Guy.
Okay, thank you. Can you hear me all right? Hello,
yeah,
can you hear me?
Yeah, fine, Guy,
yes.
for me.
Good.
Yes,
okay,
working fine.
Okay, and could you put the first slide up, please? You'll need to tell me it's up when it's up.
It's up now, Guy.
Great, thank you. I should just explain, sorry, I'm blind, so I can't actually see what's on the screen in front of me, which is problematic. And I've had some IT issues this morning as well, so apologies for a bit of a shaky start to that. Yeah, so I'm going to talk to you about CQC's perspective on the standards, and I think it's important that to appreciate that CQC were involved in the various stages of consultation on these standards. I myself, in a previous role at the Department of Health, tried to do something similar, and the timing just wasn't right for it back in 2015, 2016. So really good to see they're there. What you've got on the slide in front of you is just the various communications that CQC has put out there to say that we support these standards. We're one of the organisations who've endorsed the standards, and we go on to say that we expect all health and social care providers who use restricted practices to have training that is compliant with the RRN training standards. So the first slide really is just to emphasise that we've been consistent about this, and we have an expectation that those service providers use those standards. Can we move to the second slide, please?
It's there now, Guy, the second slide.
Right, thank you. So this really then is to sort of think through what that expectation means. And it's important to realise that there isn't a regulation that says providers need to use these standards, but there are relevant regulations. So start at the beginning, it's an expectation. So it isn't a requirement, it's an expectation that you do it. It's best practice in a similar way to NICE standards would be. So I've put two scenarios there. So one is where you have regular engagement with your inspector, there's no concern about what you're doing, and you're not using the standards. That's not going to be a problem. We would still encourage you to do it because we think it's best practice, and we think that that will make your practice safer. When you're not using the standards and there is an issue about how you're using your restrictive practices, there are various regulations which I've listed there, which we can take action under. That action could include a stronger suggestion that you use the restraint reduction, a provider who is accredited as being compliant with the Restraint Reduction Network training standards. So that's it from me for now, and hopefully that's clear. Just one thing about contractual requirements. If you're an NHS provider, there is a contractual requirement for services who would use restrictive practices that you use a training provider who is accredited by the Restraint Reduction Network. So that's for contractual as opposed to the regulatory requirement. Okay, that's it for me.
Thanks, Guy. Can I just make one clarification point, just so people are clear? What Guy's talking about there is that it's not a requirement commission that organisations meet these standards when they go in to inspect, or whatever the correct term is, Guy. But there is a requirement nationally that these standards are met. You know, they have been. It's more than an expectation that these standards are met, but that's not from the CQC perspective, if that makes sense. They're just there to inspect. What they'll do is they'll judge you against those standards if things are not looking particularly okay in any organisation. I just wanted to make that clear so people do understand that there is a national requirement. These standards are met by April 2020. Okay, over to you, Marie.
Hello everyone, I'm going to assume you can hear me unless somebody waves at me to tell me I've not unmuted myself properly. So just as a reminder, my name's Marie Lovell. I work for Skills for Care, which is the workforce development organisation for adult social care in England. And I just really want to appreciate everyone joining and CPI for putting this event on. So I just want to quickly say really that from Skills for Care's point of view, we think it's really important that everyone remembers that restraints and restrictions don't just happen in something that looks like a big institution or a health setting. They happen up and down the country in ordinary houses in people's own homes. And when they're necessary, absolutely necessary, when they're ethically and legally justified, they need to be done really properly so that they keep everyone as safe as possible, and so that people who don't have the capacity to make decisions about treatment get the treatment that they need and deserve. But we know that without proper training, people find themselves trying to deal with a difficult situation that they're just not prepared for. Restrictions can go unnoticed, even by those who are imposing them. And restraints can be improvised or can become run of the mill and kind of continue unexamined, unconsidered. So we definitely support the Restraint Reduction Network Training Standards in the aim to make sure that all social care employers, employees, individuals and families that might be affected by restraint or restrictions are properly trained and prepared. We're making sure that all of our endorsed learning providers understand the training standards and the certification scheme. And equally, we would encourage certified training organisations to consider whether our endorsement scheme can offer anything to them. So that's all I plan to say really. But obviously I'm here for questions and answers later. So I'm going to hand over to Ollie Frith, who's the Head of Consulting Services at CPI.
Yes, thanks, Marie. I'm going to be very short and brief because I want to move quickly to the Q&A spot. But what I wanted to do is, because there was a few questions on the registrations that asked how we can help. And what I want to do is make very clear that essentially if you receive training from an external provider, then they should be compliant with the RRN standards. If, however, you receive training for in-house instructors, then as well as them being a certified training provider, they should be able to support you through the affiliation process. So if you're a customer of CPI, then we have the portal and the self-assessment process that we can help you with. And equally, if you're not a customer of CPI, then I'd absolutely recommend you go to whoever your provider is and ask the questions, are they a certified training provider? And make sure that's the case. And then also ask them how they can help you through the affiliation process. At CPI, we've got the consulting services, which if you wanted wider support, then we can help with that strategic commitment for culture change. And essentially, as you've heard from Joy and Chris and Marie and Guy, this is around trying to change the whole cultural of the organisation, not just a tick box for training standards to be put in place, but actually really trying to look at everything that links to really creating that best practice. So I'm going to move on to the Q&A, and we've got a number of questions that have been sent in. The reason I've had my video turned off is because I've been sort of trying to monitor those. So I'm going to go to the first question that's come in through us on today. And this is from Simon Smart, who says, we supply temporary staff for the care sector. How can we perform a training needs analysis for staff member that will go into multiple locations with varying needs, varying levels of needs? So I don't know if there's someone on the panel that wants to pick up that answer.
I'm just wondering, I mean, I could give a response and then maybe Glyn might want to say something from Bild ACT RRN perspective. But we were aware when the scheme was being established and the standards were being developed that there was a main focus on staff who were employed within service providers across all sectors, but there has been subsequent some appendices drawn up, particularly because we know that agencies, organisations who are providing supply staff might particularly struggle to meet some of the standards because they can't control, for example, the policy of that organisation. So there is an appendices, and that is designed to help agencies who do provide staff to be compliant. Glyn, I don't know if there's anything else that I've missed or that you wanted to say to that point.
What I would say, Glyn Connolly, Bild ACT certification manager, by the way, is one of the questions that we get asked the most, and it is very difficult if you've got an agency who is supplying multiple organisations and has got a group of staff going to different places at different times. But I think that's one of the fundamentals almost of the standards themselves. The TNA is really important in a way of making sure that staff get the right training for the right group of people that they're supporting at that particular time. As you said, Chris, the standards or the RRN have developed an appendices that I think people have fed back on. And I think over time it will develop even more. I don't think there's a perfect answer to this one at all, I have to say.
Okay, thanks, Glyn. Chris, I'll move on to the next question. There's a number of questions that have come in that are all under the same theme. So Ali Bellaby has asked a question, and a number of other people are also the same, around are the standards required in education settings as well? And someone also put in a question about as an SEN school who use principles of these training practices, being interested in these standards and how they apply to educational settings.
Again, I mean, I can say something, Ollie, from our perspective and the schools and the education providers that we work with. That there was some statutory guidance issued by the Department for Education that relates to the previous Bild scheme that recognised the importance of the accredited training as it was under that scheme, particularly for those settings such as special education alternative provision. My understanding through this process was the Department for Education are in support of improving these standards and where the RRN have come. And my understanding is that they are looking at some guidance, but as yet nothing has been circulated. And I guess a bit like the statutory guidance the Department of Health are working on, COVID has pushed other priorities to the front. And so some of these things, although of equal importance, have kind of sat in the background a little. So as far as I know, going back to the, one of the previous things I said, these standards have been designed for all sectors. They're about addressing the wider issue of restrictive practices to emphasize that if we can eliminate them or minimize them, that should be our aim. And I think that my experience and the engagement I've had with the Department for Education is they're absolutely on board and want to ensure they support schools to work to the standards. Probably, as Guy said, from an Ofsted point of view, there probably isn't a specific regulation that makes the RRN standards a requirement. That won't be in their regulatory framework, and it's certainly not in any regulatory guidance for them to follow. But I assume, like CQC, Ofsted would take a similar approach. They would want to see that schools where this type of training is necessary are using certified training providers, or they're an affiliate that the program that staff undergo is certified to the RRN standards. I would also assume that if Ofsted were concerned that a school or a service, an education service, couldn't demonstrate a benchmark to these standards, and if there was other concerns about the wider use of restrictive practices, then I'm sure Ofsted would raise that as a concern. Again, whether Glyn or Guy know anything more, or perhaps Marie.
Yeah, I don't think I can add anything much to that, Chris. The standards were written to be applicable to education, health and social care, and I think you and Guy have articulated well the different the different stages of how they might be mandatory or enforced. But I guess the underlying question that, you know, a lot of people would ask, people who use services and families, would be, why would you not want to use trainers who are certified and meeting the standards? And I guess the only answer I can think of is because it's a bit cheaper not to. So, you know, whether it's required legally or not, we'd certainly be encouraging people to primarily look at training provision that is meeting the standards.
And Guy, were you going to add something to that?
Just very similar to what Chris had said. So it's recognised as best practice for design for education, but there isn't either a legal or there isn't a legal requirement for them to be used in special schools. But it is best practice, and as Marie said, if you're providing training, why wouldn't you provide training that's recognised as being quality assured?
Okay, thank you. And so the next, there's a couple of questions around the Care Commission in Scotland and whether or not Care Inspectorate Scotland will have a stance on this and how these standards apply. And these two questions are regarding Scotland, but I suppose if we could talk about UK-wide and implications across the board.
Yeah, I'll have a go at Scotland. I think it will be very similar, if not exactly the same as us. So there won't be a regulation that says you need to have these to use a certified training provider, but there will be regulations very similar to ours around safety and around training. And if you can be, you know, if there's a breach of those, then there can be both recommendations and requirements as to what you must do to put that breach right. So it's going to be the same as us, nothing specific on the standards, but there is something specific about the quality of training and about the safety of the people who you're caring for.
Okay, thank you for that, Guy.
Ollie, sorry, just because I know Beth Morrison had registered to attend, so hopefully Beth is on the webinar. But I know Beth, like Aji, has campaigned tirelessly to give the family perspective based on her and her son's experiences at school. And I know Beth has been doing some work with the Scottish Parliament, and things are moving to try and strengthen the link to the RRN standards for service providers across all sectors. And I can also comment specifically for Northern Ireland, because the Northern Ireland Assembly was suspended for a period of time, but I definitely know through the work I'm doing there that it's also on the agenda. And as Marie and Guy said, and Joy kind of opened up, that this is really about changing the culture of organisations and ensuring that we raise the standards in terms of staff practice, staff knowledge, staff skills. That's one aspect to which training contributes. But then there's the other aspects that the standards address in terms of making sure it's the right training for the right people, that organisations have some oversight, that if restricted practices are being used or staff are being taught specific interventions, that there's some quality assurance around that. And importantly, I would say organisation, authorization and approval, because I think in the past, some organisations that certainly we worked with, their response has been, yes, we provide training, but somebody else in our organisation can tell you about it. I think one of the key changes for these standards is it's really trying to engage organisations at the highest level and say, you know, what are you doing as a service to address this? And how much do you know about the training? Are you actually ensuring that it is quality assured, and are you authorizing exactly what restricted practices are permissible, and then also what you're doing to ensure those practices are lawful and just based on human rights, and importantly not misused or abused. So I think all the different governments across the UK, if they aren't as far forward as perhaps England is, and the the changes that have supported the standards, I think we'll start to see those changes appear over the next year or two across the devolved governments.
Okay, thanks for that, Chris. Guy, there's a question that's been aimed at you. Does CQC provide a 12-month grace period when it comes to training staff in the new RRN standards? I mean, I think you probably answered that by your presentation, but I didn't know if you wanted to add anything.
Sure. So I'm just trying to think what to add to that. So the issue would be what's happening to what quality of care are the people you're caring for receiving? If they're receiving poor care, if restrictive practice is inappropriate, if they're not safe, then we would take action around those regulations. So if it is safe, then we would encourage you to take up that training. So it depends really on what your service is doing in the meantime. Does that make sense?
Yeah, I think that makes perfect sense. Thanks, Guy. There's just another question that's coming. I'm just aware of time, but there's another question that's coming asking who the best person to link with in regards to ongoing work with the standards in Northern Ireland. So has anyone got a signpost that we can support that question?
I don't, Glyn, do you know where the progress is at? Or like I say, I've had liaison with various different people in the Department of Health, and like I say, I think that the take I have is it is something everybody definitely wants to move and sign up to and encourage providers, but I'm not sure if anything more on a political level has been.
No, I don't know, Chris. I think the best person, well, is either Joy or Sarah, who works for the RRN, really.
Sorry, it's not something I've been privy to, so I really can't answer that, unfortunately. I don't know if we can find out and maybe email people.
So
I'm quite happy to ask Sarah and try and get an answer if she knows.
Okay, thanks. We'll try and locate an answer, a response, and we'll send that out if we with what we find. Just a sort of final one. There's a collection of questions that many of them are relating to CPI and MAPA, but I can probably assume that would also apply to other providers that deliver certified training. And in a sense, what the questions are asking is to what extent are these standards going to change the way in which the training is delivered, or will the course content change? So are people going to be, should people expect a new sort of revision of course content for what they're delivering?
I can give our perspective as one of a number of certified training providers, and again, for those people who don't work with CPI, I assume you'll be working with another provider, and if you're not sure who the providers are, you can go onto the Bild ACT website and there's a full list, because that, again, for me, that was one of the changes to the scheme, is because of all the quality assurance mechanisms, anybody can see exactly who is a certified provider. Everybody will be able to see who's an affiliate. Commissioners will be able to see that, and regulators will be able to see that. And that's really important, because one of the things, the previous Bild scheme made positive strides, but probably the focus at that time was really about a lot to do with physical skills, and is that training that a training provider delivers, does it meet the standards of that scheme? The RRNIC is slightly different, and I think we were previously accredited as were the other providers on the website, and so I can only speak for CPI. What the process of RRN certification did for us is we were then being measured, and our program, our curriculum, our quality assurance mechanisms were being measured against a new set of standards. And whilst we met some of the standards, there were some new standards we didn't meet, or we didn't meet to the satisfaction of the scheme. So it did mean we had to rethink how our training is currently managed and delivered and what the curriculum is, and we had to make improvements. And ultimately, for me, that's the test of the scheme. It forced us to make improvements, and they were genuine improvements. So we in particular as a provider, so again, I can't speak on behalf of others, but I would assume a similar process would have happened, is that the standards are different. They stretch training providers that much more. There's a greater focus on human rights. There's a much clearer focus on prevention. So our package that's been certified was adapted, was improved, and actually as a result of becoming certified, we've just done another revision to strengthen it even more, because what we're required to do under the scheme is to meet all the standards. We can't nearly meet or partially meet a standard. It has to be an absolute. So our experience has been really, really positive. And for anybody who works for a certified training provider, I would anticipate you should have the same experience. You should be seeing improvements to the curriculum. You should be seeing stronger quality assurance mechanisms. So because there's this extra step that the RRN standards take that compared to the previous scheme. The previous scheme, we just had to demonstrate our curriculum met the Bild code of practice. And then we just went and did the training. If we trained an instructor, the instructor then onward delivered the training into their organization. And we as a training provider had some internal quality assurance checks, but they were down to us. They weren't necessarily down to the scheme. The big difference now is within the RRN training standards. If we're training an instructor who delivers our package onward into their organization, those quality assurance mechanisms then go into that third party provider. So that organization who's got their instructor, who's training their staff in our package, yes, they should be assured that the package itself meets the RRN standards, but there's other aspects, such as Glyn mentioned, on getting the training needs analysis right. It becomes incumbent then on the service provider to meet those standards and to evidence they've put all those other checks and balances in place, because your certified provider, for example, can't tell you what your policy or should or shouldn't be. The training provider can't even say whether your policy is good, bad, or indifferent, because that's not their responsibility. So I think what the standards do now is address that gap and say, you're the service provider. You might have a contractual obligation if it's an NHS commissioned service. You'll have a regulatory requirement to make sure services are safe.
Chris, I'm just very mindful of time.
Sorry, Joe. Yeah,
but the question that was asked, to be honest, but I think they were asking about whether standards going to be reviewed. That was my sense of what the question was.
Sorry, I thought it was about the follow-up.
Well, I mean, the questions that came in, they were around people worrying about what the content of the curriculum that they're purchasing from various providers, was that going to change in line with the standards? So I think you've answered that, Chris. So Joy, yeah, you're right. I'll pass you back to Joy.
That people may not know that we are doing an evaluation of the standards. We've secured funding to do a 1-year evaluation of the standards, which we're just starting. Which we have commissioned somebody to do. And we will be able to report on that subsequently at the end of the year or early next year, and that will feed in then to how we might want to make any amendments or changes to the standards going forward next year. So I just wanted to say that was important. Yeah, sorry, Ollie.
No, that's all right. You're right. I'm glad you're able to put that in there. And so just looking at time, I think unless anyone else, Glyn or Guy, Marie, you've got anything else to add, I think it's just a case of saying thank you to people, to our panel for giving us your time but also thank you for people to take the time to listen to this webinar. Essentially, the message is, if you've got questions, I know there are some last minute questions that came in that we weren't able to answer. If you've got overarching questions still, then our recommendation would be to go back to your certified training provider and ask them to support you through the process to really make sure that what you're doing is able to meet those RRN standards in the most appropriate way.
Okay, just one final word, Ollie, just to say that I hope that people, one, have found this helpful, but two, don't see the standards as just a hoop to jump through, I guess. You know, this is a real opportunity to make a massive difference to this agenda and to people's lives in minimising trauma, I think, for both service users, families and staff themselves. So that's my final thoughts on the matter.
Well, thank you for your time, and a recording of this has been made and it will get sent out to all of you that have registered. So thank you very much.
Yeah, thank you everybody for attending.
Thanks everyone. I know there's a couple of links in the chat. The Bild ACT scheme have lots of frequently asked questions on their website, so any we haven't managed to cover might be answered there, or you can contact them directly.
I've just noticed a last minute question saying, will we be able to share the recording? I think my understanding is absolutely. If you know, feel free to share the recording with whoever you feel is appropriate.
Okay, brilliant. Thanks for everybody's time. Thank you.